Here are some signs that there's something wrong with your child's teeth that I wish more parents knew. Before I start, please know that this list is not exhaustive and the images I show you are from the contemporary orthodontics textbook, as I'm unable to show you real clinical images due to privacy concerns. A posterior crossbite happens when the upper jaw is narrow and is often present in children who have prolonged sucking habits. So it looks something like this. So this child here has two bites, or what we call a mandibular shift, meaning because the bite is unstable, the patient then slides the jaw to one side, and this is what we call a posterior crossbite, where the lower teeth are sitting outside of the upper teeth. This patient has a severe constricted maxilla, so there are crossbites on both the right side and the left side. This is an example of some of the expanders that we can use to correct the crossbite. This is another example of an expander to expand a narrow upper jaw. Next, we have anterior crossbite, which means that the upper front tooth is behind the lower front tooth. This is another example of an anterior crossbite where the upper tooth is behind the lower front tooth. Some methods used to treat anterior crossbites will include a removable appliance with a spring where we will push the upper front tooth outwards, or we can use some form of fixed braces like this in order to straighten the teeth and correct the crossbite. Next, we have anterior open bite. And this is most commonly caused by thumb sucking. Once the habit was stopped, the anterior open bite corrected. Non-dental intervention methods include using a bandage. Appliance therapy will include something like this, which is what we call a crib, stop the tongue from moving outwards. Over-retained primary teeth are teeth that do not exfoliate or fall off even after the permanent tooth is out. While it's very common for the lower adult teeth to erupt behind the baby teeth, if the lower adult teeth are fully out and the baby teeth are not shaky, it may be advisable to remove the baby teeth. Next will be permanent teeth that do not follow their eruption path. The most common example will be the adult first molars that press against the last primary molar. You can see this baby tooth getting sort of eaten away by the adult tooth, and this is what we call resorption. In mild cases, there may not be any symptoms, but when it is severe, there can be symptoms such as toothache. Another example would be the canines. Canines are also a commonly impacted tooth. Instead of erupting downwards, in this case it erupted sideways and started causing damage to the adult teeth next to it. For patients with an underbite with a small upper jaw or a large lower jaw, we can do what we call a face mask, where we pull the upper jaw forward in this direction. Doing this young can help to pull the upper jaw forward. For patients with a small lower jaw, we can help to grow the lower jaw by using appliances like this that help the patient protrude the lower jaw forward. This is another example called a twin block. It comes in separate upper and lower pieces, and there are planes in order to help the patient to advance their lower jaw. A proper assessment is really important. While not all cases may require growth modification, for some cases timing is key, as growth modification has to be done before the adolescent growth spurt. It's very important to have an orthodontic assessment for your child so that we can advise you accordingly.